Time, everyone. Welcome to learning about your flexible spending account and our commuter accounts. I am Linda Fries. I'm the benefits manager for PEBB. We're going to give it just a minute or so to let people join in on this webinar, but I hope everyone's doing okay today. And it's kind of raining. I'm out on the coast, so it's kind of a rainy day. I don't know where you're at. My parents live in Kentucky and they've already had snow. So at least we haven't had any snow yet, right? All right, I still see a few people joining, but Sarah, let's go ahead and we'll go through some of the housekeeping. Okay, webinar tips. Check your audio. If you're not hearing the webinar, go to the audio tab in the GoToWebinar. Select for your preferred speaker and microphone. If that doesn't happen, you can always log out of the webinar and log back in, and usually that takes care of it. If you want to ask any questions, you have a little questions tab. You can type in, it's just like we're texting with one another. It only goes to our team here at PEBB, and when we respond, we're only responding to you. Anyone that signed up for this webinar, and I heard that we had over 1,000 people sign up for this webinar. So anyone that signed up for this webinar will receive a follow-up email with a link to the recording of the email. And if you need any other benefit information, you can always go to our state website that is at www.pebinfo.com. Well, let's get going. We've got a lot of information to cover today. We're going to talk about the confirmation letters, the hard copy letters and the emails that PEBB does every year. We've been doing them probably for about the last, I don't know, 7 or 8 years, just to make sure members are enrolled in the correct account. We're going to talk about our correction timeline for FSAs. We're going to do a little bit of an overview on flexible spending accounts, and then an overview on the commuter benefit accounts. The last 2 bullet points are going to be very similar to our pre-open enrollment webinar that we did on FSAs. All right. So confirmation letters. We will be sending out 4 types of emails, 4 types of confirmation letters, depending on the account that you enrolled in. So we will be sending out healthcare FSA letters to healthcare FSA enrollees, and the same thing for dependent care, parking commuter account, or transportation commuter account. So if you enrolled in more than one of these accounts, you will get 2 letters from us or 2 emails. If you enrolled in all 4, you'll get 4 letters. So the way that we do this is we're going to send you some emails, and we try to make the emails a little color-coded as much as we can. And you're also going to be receiving hard copy in the mail letters. And we color code them, like the healthcare FSA letter is going to be on blue paper, the dependent care will be on pink paper, the parking account will be on orange, and the transportation green. It makes it easy for you. It also makes it easy for us if you call in with questions or you're not quite sure. It's really easy for us to say, okay, what color was your letter? And you can say, oh, it was pink. Okay, we know that you're talking about a dependent care FSA. All right, next slide. So here's kind of an example on what they look like. These are your postal service, your hard copy letters. We send these out to say, hey, Linda Freeze, you have enrolled in a healthcare FSA. You are contributing $100 per month into this FSA. This is what you can use the FSA for. This is what you probably can't use it for. And a lot of people get very confused with the dependent care FSA. And that's why we kind of do, this is what you can use it for, this is what you can't use it for. The dependent care FSA is for your dependent children that are age 13 or younger, and it is for their daycare expenses while you are at work. It is for, I'm going to repeat that again, their daycare expenses while you are at work. The dependent care FSA does not cover braces or glasses or doctor appointments, and a lot of people get that confused. So just keep in mind, braces, vision, getting a pair of glasses, paying for doctor appointments, that goes under the healthcare FSA for you and your eligible dependents. The dependent care FSA is for your kids age 13 or younger, and it's for their daycare expenses while you're at work. And so that's what these letters and emails talk about. They're like, hey, you enrolled in this account. Did you really mean to enroll in this account? Here's how much you're putting in it per month. So we try to give you all that information. If you read the letter and you go, oh, I didn't mean to enroll in this account, I enrolled in the wrong account, then we give you rules for how you can make your corrections and the deadlines and the penalties if you don't get your corrections in a timely manner. So it's really important when you get these letters that you review them, you look at them, you digest them, you read the entire letter to make sure that you are in the correct account that suits you and your family. All right. Next slide. So the blue letter, the healthcare FSA, again, this is going to cover healthcare costs for you and your eligible dependents. So medical, dental, vision, going and picking up FSA eligible items at the drugstore, your prescriptions. And again, this is for you, this is for your spouse, this is for your eligible dependent children. All right, next slide. Dependent care FSA, again, this is daycare costs for your kids that are age 13 and younger. So really take a look at this. This dependent care FSA does not cover any medical, dental, or vision expenses for your kids. So if you enrolled in this and you don't have any kids that are age 13 or younger, you enrolled in the wrong FSA. So pay attention to this letter when it comes in. I'm checking the questions, and okay, I'm seeing a few questions coming in. Sarah, next slide. FSA corrections. Oh, I see somebody saying it's overcast in Salem. Yeah, I'm in Lincoln City and it's overcast here and a little sprinkly. But hey, I have power and the winds are not 60 miles per hour, so I'm kind of happy about that. FSA corrections. If you feel like you made an error during open enrollment to enroll in an FSA, or you think, oh my goodness, I enrolled in the wrong FSA, or I put too much money in or not enough money, it's okay. You can fill out an FSA correction form on our website, and you can get that correction into us. We do ask for corrections to be into us no later than Friday, December 12th. We do that for a couple of reasons, because we want payroll. We want to get things in the system correctly for you before payroll starts to process pay for the January 1st paycheck. And we also ask that you get things into us by December 12th so that my staff, who has literally been doing open enrollments since August 15th, can have a little bit of a breather during the Christmas holidays. So we like to get a lot of the forms done early in the month so that we're not, you know, not taking time off at Christmas and spending time with our family. So that's important to us. That's important to me as a manager, that they spend time with their family. If you do not get your correction in by the deadline, then you can only make corrections to your FSA or with a qualified status change. So you need to be, you know, you need to be on top of it. You know, I enrolled in a healthcare FSA for 2026, and I will probably update my amount. So I'll do that by December 12th. Because I'm starting to realize I might have some additional procedures done next year. So I'm like, oh, okay, I might up my amount. So those are things that you think about. And you've got a little bit of time to make some changes if you need to. All right, next slide. So here's the form. It's the 2026 FSA open enrollment and correction. You can basically make corrections to your dependent care and healthcare FSA. And you can find all of our forms at www.pebinfo.com under resources and then under forms. So you can always find all of our forms under forms. All right, next slide. This is the parking account letter. Again, this is parking not for state lots, okay? So this is where our membership, PEBB membership, gets confused. If you already have a payroll deduction coming out of your check that is pre-tax because you're parking in a state-owned lot, or your university charges you to park in their lot and they withhold the money pre-tax, then this parking account might not be the account for you. This would be when you are parking for your work at a lot that is not connected to your payroll deduction. I hope that makes sense. For example, when the PEBB staff was working on Summer Street, I did not park in a state-owned parking lot. I parked over at the Lee Apartments, and the Lee Apartments charged me so much money per month to park there. It didn't come out of my paycheck at all. I had to pay Lee Apartments directly. I would be able to use the parking account for that. If you work for the state and you're parking like in the green lot or the red lot, and it's already coming out of your paycheck pre-tax, you should not be enrolled in this account. I hope that makes sense. I hope that makes sense. Okay, next slide. This is our transportation account. Transportation account on the green paper. This is if you're commuting into work, like maybe you're part of a van pool, or you take the train into work. Then you would use a transportation account. This is probably the least used account out of the PEBB portfolio. You cannot use the transportation account for your bike, for rain gear, for a you know, a light that you wear around your head so that you can see in the dark, for fuel for your car, for car repairs, for Uber, anything like that. The transportation account is not for that. It would be for um, basically public transportation to get you from point A to work. All right, next question or next slide. Okay, corrections. Let's pause just a minute and let's look at some of the questions coming in, because I do see some questions coming in. I think somebody's asking, have we received these letters yet? And the answer is no, the letters have not gone out in the mail. You will receiving them. Forrest, when do you think these will go out?
Hey, Linda. I know we will at least be sending this information in a Gov delivery message this week. And we are currently working on getting the letters finalized. So, Sarah, do you know specifically when the letters might come out?
Yeah, our goal for the letters is to have them mailing Monday or Tuesday of next week at the latest.
Yeah, so just watch for them. You know, you can also get back into your PEBB account and look at your benefit summary. So if you go to where you did your open enrollment, www.pebbenroll.com, and you log back in and just go to your benefit summary, you can see what you've enrolled in for 2026. But these letters and an email will be coming out to just confirm your enrollments. And if everything looks great, you don't have to do anything. So that's also easy too. Somebody's asking, can I change my contribution amount at any time? You can change your contribution amount for your healthcare and dependent care FSA up until December 12th. Once the plan year starts, once January 1st starts, those amounts are locked in. That's why we do these webinars, and that's why we do the mailings, because we want you to understand it's really hard to change your FSAs once January 1st hits. You have to legitimately experience a qualified status change. And with that qualified status change, you have to alert us within 30 days of that qualified status change. If you alert us like 60 days after, you know, after your child stopped going to ABC daycare, then it's not a qualified status change because you waited too long to do it. So I hope that helps. All right, well, let's go on. I see that staff's answering a lot of the questions, so thank you, everyone. Okay, commuter account corrections. They have, for the commuter accounts, which are the parking and the transportation, they have their own form. It's not the FSA form. Again, you can find that under forms, which lives under resources at www.pebinfo.com. All right, thanks, Sarah. Next slide. Okay, corrections. So listen up, everybody, because corrections, it's really, really important. You must request changes to your 2026 FSAs by December 12th. So that's next month. That's 1 month away. It's November 12th today. How about that? Updates will be effective January 1st, 2026. If you did not do open enrollment last month during the month of October, then you cannot sign up for an FSA. The only way you would get an FSA in 2026 is if you experience a qualified status change during 2026. But if you get a hold of us, you know, in the next month, month and a half, and you're like, I didn't do open enrollment, but I really need my FSA. Will you please let me have an FSA? The answer, unfortunately, is no. Make sure that you understand your choices, the amounts, and the penalties if you don't make your changes before January 1st. So again, you're going to get these communications from us. Make sure that you read the letters or the emails completely so that you understand exactly what you're enrolled in, and what to do if that's not correct for you and your family. All right, Sarah, next slide. As of January 1st, so let's say January 1st hits and you're like, oh, I forgot to make a correction. Any changes with ASI Flex issues, they come to us as an appeal. There are no healthcare or dependent care cancellations or changes unless you experience a qualified status change. Let me say that again. There are no healthcare or dependent care cancellations or changes unless you experience a qualified status change. A qualified status change could be a birth, a marriage, a divorce, a death. So things like that. So please understand that. Getting pregnant in February is not a qualified status change. Knowing that you have a surgery scheduled in March, but you find out in February, oh, I don't need that surgery, that's not a qualified status change to either increase or lower your healthcare FSA. Yes, we get those questions every year. No retroactive FSA corrections or enrollments. Sometimes members lose money because they enrolled in the wrong account and they cannot get out of it because the plan year has started. No mid-year enrollments or prospective increases or decreases without a QSC, which is a qualified status change. The only thing PEBB will do is adjust the number of months prospectively if you enroll mid-year with a qualified status change. So we do have some university members that only get so many paychecks per year, and that's what this bullet point is about, that we will adjust the number of months so that it's correct and it reconciles with payroll at your university. But that's really a lot of the changes that PEBB does. Okay, next slide. University members, so this is where it's talking about those number of paychecks. So when you went in and did open enrollment, you had to mark, you know, am I 9 months, 10 months, 11 months, 12 months, no contribution months. Believe it or not, when we have 60,000 people going through open enrollment, some of you get this wrong. And so Anai and Rhonda really work with your payroll, and this is where we adjust the number of months by making sure that it matches up with the payroll at your employment. All right, next slide. Okay, let's pause. Anai, Rhonda, are there any questions, like major repetitive questions coming in that we need to answer?
There's a lot of questions about how it made it pre-tax or what qualifies as an eligible expense. A lot of things along that line.
Okay, so it is pre-tax because it is an account that is set up as a pre-tax account, but it is also monitored and basically officiated, if you want to call it, by the IRS. And that's why we have all these rules around it about you can't make changes or you can only make changes with this or that, because it is monitored by the Internal Revenue Service. because it's a way for you to put money in pre-tax to use it for medical expenses or daycare expenses. And so the feds have a little bit of an issue, you know, if people start making adjustments throughout the plan year. What can you use it for? You can go to the ASI Flex website, and you can look at what would be eligible expenses. And I also think that they have like what would probably be ineligible expenses. But I can tell you that I've had the healthcare FSA for I think 2 years now. And I just download the app on my phone. And when I come back from the pharmacy or I get a bill in from my doctor, I just take a picture of it, get on the app, fill in the information, and send it off to ASI Flex. It takes me maybe 4 minutes to do it on the app, and I have a check within a couple of weeks. So it's really easy, I think, to use, and it's pre-tax savings. I see, does our FSA balance roll over from year to year? Let's talk about that. If you enroll in your healthcare FSA through December 31st, so next month is December, and if you've been in the healthcare FSA for 2025 and you contribute through next month, then you have a 3.5-month grace period. And there's a slide a little bit on in the presentation that talks about that. But our board decided, rather than to allow like so much of it to roll over, that they would do a 3.5-month grace period. So you have until March 15th to have some extra claims. So if you have like $1,000 left in your healthcare FSA, you have January, February, March 15th. So it's not really, it's 2.5 months, sorry, not 3.5 months. You have until March 15th to accrue or to use that healthcare FSA. So you have a little bit of time for that. All claims for 2025 are due to ASI Flex by March 31st of 2026. That is hard. So that's a concrete wall there, that all claims are due for 2025 to ASI Flex no later than March 31st. Do not wait until March 31st to turn in your claims, because guess what? You have procrastinated along with thousands of other people, and their website can get a little scary to use on March 31st. So get your claims in right now. I still have like $150 in my healthcare FSA, and I'm like, I need to get some claims in and use that money up because I don't want to lose it. So I think enough said about that. Rhonda, Anai, any other questions that you think we need to talk about?
There is a couple of questions on what happens with the money if they don't use it.
That's a good question. You know, if you don't use your money that's in your account and it expires, and so the money goes to PEBB, and the money sets into one of our funds that helps buy down the premiums on the PEBB plans. So, I mean, the money doesn't go back to your employer, the money doesn't go back to you. The money basically sits with PEBB and it gets put into another fund, and we use it to help buy down the premiums on the PEBB side. All right, let's go. We've got, what is an FSA? Whoops, let's go back to okay. Let's go the slide right before that. There we go. So we offer two types of FSAs, the healthcare and the dependent care. Again, we've already talked about this. The healthcare FSA covers eligible medical, dental, and vision expenses. It includes deductibles, copays, office visits, tests, supplies, and you can see the full list on the ASI website. I think somebody always asks about supplements, and on the surface, ASI Flex will not cover your vitamins, your supplements, but ASI Flex has covered my supplements this year because my naturopath wrote me out a letter stating that I needed to take these supplements for these reasons. And when I uploaded my first receipt with my supplements, I also uploaded that letter from my naturopath. So you may have to do extra things like that in order to get some things covered. So just kind of keep that in mind. Dependent care FSA, it covers your eligible dependent care expenses. It includes child care for children up to age 13, and it can cover some care for elders that are living under your roof. So you can find a full list at the ASI Flex site. Okay, Sarah, next slide. Okay, the IRS rules for FSAs, you have to enroll annually. This is why we tell members all the time, open enrollment is mandatory. If you do not do open enrollment, you will lose your healthcare or your dependent care FSA. You must do open enrollment to enroll in a healthcare or a dependent care FSA, even if you're currently enrolled in a healthcare or dependent care FSA. And we have to do that because the IRS tells us we have to do that. You don't have to have PEBB health insurance to enroll in an FSA. You can access the full healthcare funds amount at any time during the plan year. So if you contribute $2,000 to your healthcare FSA and your first deduction of, you know, what is it, 175, 180 bucks happens January 1st, you have the full $2,000 to use effective January 1st for your healthcare FSA. But you have to continue to make your contributions throughout the plan year to cover that $2,000. Unused funds are forfeited if not used within the year, and we just kind of talked about that. Expenses can be for your spouse and your dependent children, not for domestic partners. And that's not a PEBB rule, that's an IRS rule. We have a 2.5-month grace period. We talked about that through March 15th. If you contribute and you're enrolled through December 31st. And again, the PEBB board chose to offer the 2.5-month grace period rather than a rollover. That's one thing that, you know, we had to decide when we initiated the plan and brought it into the PEBB system. So it's been this way for a very long time, even before I started working at PEBB. All right, next slide. How does an FSA work? Number one, you're going to estimate your expenses for the upcoming year. So when I say estimate your expenses, you know, how much are your prescriptions every month? How much are the prescriptions for your spouse or your children? So these are things that are kind of set in stone. You know that you're going to have these expenses every month. You know that you're going to have some procedures done next year. For example, maybe you just had a tooth extracted and you know that you're going to get a dental implant in March or April. So you know that that's coming. So you estimate your expenses. I will tell you, be conservative, because if you overestimate and January 1st hits, you cannot lower your healthcare FSA. You're going to make pre-tax contributions via your paycheck all throughout the next plan year. You're going to incur eligible expenses. You're going to turn those claims over to ASI Flex by the deadline dates, and you get reimbursed. So it's actually pretty streamlined and easy. Just keep in mind when you submit claims to ASI Flex, you might have to submit some additional documentation. So not always, not most of the time, but some of the times you might have to do that. Okay, next slide. For the healthcare FSA, the annual maximum is $3,300 for you and your family. Again, plan for predictable, reoccurring expenses. Be conservative. Look at this plan year as kind of your guide. Be conservative because everything's final. Once January 1st hits, everything is final. You do have a grace period if you contribute through December 31st, so that would take you until March 15th of 2027 would be your grace period if you don't use up all of your funds for 2026. All right, next slide. Eligible expenses, doctor appointments, your co-pays, your deductibles, x-rays, labs, hospital visits, the mileage to and from healthcare providers, MRIs, hospital stays. So there's just a lot there. Over-the-counter stuff like Band-Aids, sunscreen, braces, first aid supplies, pill holders. Braces aren't really over the counter. I guess maybe if it's for your arm or your leg, you can use braces there. Blood pressure monitors, thermometers, diabetic supplies, vision exams, your glasses, your prescription sunglasses, contact lenses, reading glasses, the LASIK surgery, dental exams, x-rays, fillings, braces, crowns and bridges, dentures, adhesives, night guards, implants, and then hearing exams, hearing aids, hearing aid batteries. So there's lots of different ways to use your healthcare FSA. ASI Flex has a terrific FSA store, and sometimes they offer discounts. When you sign up with them, they'll send you an email like, oh, take some money off on the FSA store. So you can use directly your healthcare FSA just to buy things from their store, and you know that it qualifies because you're using their store to buy it. All right, next slide. Ineligible expenses for your healthcare FSA, services that haven't happened yet. So pre-treatment estimates, you can't use it because the service hasn't happened yet. Cosmetic treatments or medications, illegal operations, expenses paid by insurance, diapers and maternity clothes, insurance premiums, dancing and swim lessons, holistic treatments, natural remedies, vitamins. Again, I got my supplements covered because my naturopath wrote a letter that said Linda has these conditions, and because of these conditions, she needs to take these supplements. Let's go back to that slide, the previous one. Warranties, and then healthcare services for your domestic partner. Remember, if you have a domestic partner, your healthcare FSA will not work for them. Okay, next slide. Thanks, Sarah. This upcoming plan year, we have a new partner that kind of comes in with your FSA, and that's Garner. And if you've enrolled in a Providence Health plan or a MODA plan, and you are using Garner, you've signed up for it, keep in mind that you can't double dip. You can't get reimbursed from Garner for, you know, your deductible, you know, your co-insurance, your prescriptions with Dr. Smith if you're also getting reimbursed through Garner for that. You probably want to use your Garner funds first and then your FSA funds after that, or you use your FSA funds for doctors that are not top providers with Garner. So it's going to be a little bit of coordination on our side to make sure that we're not double dipping and we're waiting for the Garner reimbursement to come in. And then, you know, once we've used up those funds, then we can start using the healthcare FSA. Or if Dr. Smith is a top provider and you've seen him, but you also see Dr. Jones and he is not in Garner, then anything you do with Dr. Jones, you can go ahead and use that for your ASI Flex account. Garner also doesn't cover your dental or your vision. So if you're going in and getting braces, whatever, you can use your FSA 100% starting January 1st for that. So thanks, Sarah, for this slide. Step 1, you can get reimbursed by Garner. Use the Garner to find Garner approved providers. Pay the costs out of your pocket and Garner will reimburse you. I was actually just on my Garner app before this webinar because I want one of my doctors that I see to be a top provider, and he's not listed as a top provider. So I filled out a form with them in their little chat area, and I'm trying to get him added as a top provider. So you can do that. And I've also noticed in the last several months, they've added a lot of providers on the PEBB side that weren't there 3 or 4 months ago. So if you haven't been in there for a while, get back in there and plug in your doctors and see if they're there. So, okay, that's what I'm gonna talk about Garner. But use your healthcare FSA to pay for other expenses. Again, this could be dental, glasses, over-the-counter medications that aren't associated with your Garner top provider. And then once you've hit the maximum of Garner reimbursing you, then go full in on your healthcare FSA. All right, next slide. The dependent care FSA, $7,500 per family. So let me say that, and the next bullet point says $3,750 a year if you're married and filing separate income tax returns. But we have seen it every plan year where Jane works for the state and Sam works for the state, and Jane puts in $7,500 and so does Sam, for a total of $15,000. You can't do that. It's $7,500 a year per family. So if your spouse works for Cold Stone Creamery and you work for PEBB and they have a dependent care FSA, the two of you combined cannot put more than $7,500 a year back for the dependent care FSA. So take a look at that and work with your spouse on that, and make sure that you haven't put over $7,500 into your dependent care FSA. You can find a full list of eligible dependent care expenses at the ASI Flex site. And again, these funds, if you don't use it, you lose it. And I'm going to tell you folks, I have seen people lose thousands of dollars with their dependent care FSA because they never put in their Claims. I don't understand it. Daycare's so expensive. Why wouldn't you put your claims in every month to get reimbursed? But some people wait until the end of the year and then they go, oh, I forgot. And they lose everything that's in there. Everything. They lose every penny that's in their dependent care FSA. Please don't be like those people. Get your claims in timely. All right, next slide. What qualifies for your dependent care FSA? So babysitting while you're at work, preschool or nursery school for your young children, before or after school care, day camps, not overnight camps, only day camps. It's for children under age 13, and it's for a child age 13 plus if they're not capable of self-care. All right, next slide. Ineligible expenses, services not yet provided, educational or tuition expenses, kindergarten or higher education costs. So school tuition, that's not eligible. Overnight camps. So if you remember from the previous slide, it would cover day camps, but it will not cover overnight camps. Services during vacation, holidays, or leave of absence. I'm getting ready to go on a cruise on Sunday. I don't have any small kids, but they do have like these daycares for kids while you're on vacation, and you have to pay for it. Those would not be included for your dependent care FSA. Only the custodial parent is eligible if you are in a divorce situation. So if you are not the custodial mother or father, then the dependent care FSA is not for you. And then what else is ineligible? Anything that goes over $7,500 per year per family. And daycare is expensive, so usually things do go over $7,500 if you have kids in daycare full time. All right, next slide. Helpful tips. Start a dependent care FSA when you're ready to begin child care, not at birth or during open enrollment. We added this bullet several years ago because we saw a lot of people that went in during open enrollment and they said, oh, I'm going to have a baby in February and I'm going to put them in daycare. So I'm going to go ahead and sign up for this dependent care FSA during open enrollment, and it's going to start January 1st. And then when the baby goes into daycare, I'm going to have this money set aside for them. Don't do it that way. Wait until baby is born and you are legitimately putting them in daycare. We've seen a lot of people that have baby and then one of the spouses, one of the parents decides not to go back to work, but yet they've created this dependent care FSA and they can't cancel it now because there's no qualified status change. You know, deciding, 4 months into having a baby to not put the baby in daycare is not a qualified status change. If your child care situation changes in 2026, you have 30 days to notify us. Let me give you some examples. We have a lot of people where the child goes to school. So in June, July, August, daycare situation goes full time because it's not before and after school care anymore. It's full-time daycare. So you might want to do a qualified status change in May or June to say, hey, my daycare costs are going to go up. And then you might want to do another qualified status change in August to say my daycare costs are going down. Maybe you already know what that is and you have it kind of averaged out for the whole plan year. That's great. We've had people where daycare has closed on them. and then a family member comes in to babysit the child, or a parent decided to quit their job and stay home, but they didn't turn in the form within 30 days, then they can't make the qualified status change. So make sure that if something's changing with your dependent care FSA, you've got 30 days to let us know. Submit claims promptly. Do not lose your funds in your dependent care FSA. That's a sad, sad day when people lose thousands of dollars in their dependent care FSA. Dependent care FSAs cannot be used for healthcare expenses for your dependents. So please, that's your healthcare FSA, not your dependent care. Okay, Sarah, next slide. Important dates for FSAs. Claims must be incurred between January 1st and March 15th, or during your coverage period. Let me talk about that. We do have some people, we have a lot of people that do the healthcare FSA. That's our most popular account out of the four. And they go on leave. Let's say that you're planning on having a baby in April. So you're going to go on leave for the month of April and May. But you're having baby in April, so you're going to have a lot of medical care costs in April. You have to continue to make your healthcare FSA contribution for the month of April and May if you want to turn claims in for April and May. If you don't make contributions for April or May, you don't get to turn claims in for the time that you're out on leave. So you can only turn claims in for the months that you made contributions. So if you missed contributions, if you missed months because you were out of work, you don't get to turn in claims for that. All claims have to be turned in no later than March 31st. Again, submit early to avoid missing the deadline. All right, next slide. Commuter benefit accounts, let's go on. We have two types. We have parking and transit, or parking and transportation. The parking, again, is for parking at your place of employment and parking at a non-state owned location from which you commute to work. Again, if you're parking already at a state-owned or a university-owned lot and they're already pulling the money out of your paycheck on a pre-tax basis, then this is not the account for you. We also have the transportation account. This is commuting via mass transit, bus, rail, ferry, van pool to get to work. Your bicycles, things like that are not included. Your own personal vehicle is not included. All right, next slide. Again, these are IRS regulated accounts, but they're a little bit different from the FSAs. You can enroll, change, or cancel at any time, okay? You can enroll, change, or cancel at any time. Your election is month to month. You don't have to do open enrollment to get a commuter account. They roll over. So if you enrolled in it for 2024, it rolled over to 2025. Your 2025 enrolled over to 2026. You can make pre-tax contributions through payroll deductions and pay for current month commuting expenses. You can submit claims for parking or transit expenses incurred during your coverage period. Reimbursements are capped at the IRS monthly limit, and unused funds are forfeited after 6 months. So if you cancel your commuter account in February, you have 6 months to use those funds. If you do not use those funds within 6 months, that account is forfeited and you lose the money that's in there. All right, next slide. The parking reimbursement amount is a maximum of $325 per month. Again, it's for non-state owned parking lots, parking meters, parking garage, parking at a place from which you commute. Sometimes people park at a lot and then they catch something else to get into work. Those are reasons why you would use your parking account. Okay, next slide. Eligible things: train, bus, subway, ferry, streetcar. I don't think we have any streetcars around here, or ferries, or subways. Van pool, subject to IRS guidelines. All right, next slide. Ineligible expenses: non-work related parking or transit costs. Parking at a state-owned lot already deducted pre-tax from your paycheck. Bicycle or repairs, Uber or Lyft, so the ride shares, gas, fuel, or vehicle repairs on your own personal vehicle. All right, next slide. IRS does require proof with claims, so you'll have to certify that the expenses are eligible and not reimbursed anywhere else. You'll have to provide third-party documentation, and if unavailable, you may have to present metered street parking. You know, sometimes you get receipts from that where you put in your credit card and you say, I'm going to be here for 3 hours, and you get a receipt. You would have to turn those in, and you can do manual submission, mail or fax, but not for online or debit card claims. All right, next slide. Important dates for commuter accounts. Again, all claims need to be in for like the 2025 plan year by March 31st, 2026. All claims for 2026 need to be in by March 31st, 2027. Inactive accounts where you have canceled them and then you haven't used the funds for 6 months or 180 days are terminated and balances are forfeited. University members, when enrolling online, make sure, again, you do the correct number of months. All right, next slide. Here is the ASI Flex customer service, their website, their email. If you're not jotting this down right now, you can also go to the PEBB state website, and all of the ASI Flex information is there under our carriers and vendors, and links that will take you directly to their website are there also. All right, next slide. All right, and PEBB member services. We are open Monday through Friday, 8 to 5, closed weekends and holidays, but I think some of our staff sneaks in on the weekends sometimes and looks at emails. I'm not going to say who, but I think it happens. We have email. Our enrollment site is right, www.pebenroll. Our information is pebinfo.com, and then under resources and forms, you will find all of our forms. All right, I think that's it, isn't it, Sarah?
That's it.
Do we have, Rhonda, do we have any questions that would be beneficial?
Hey, Linda, I want to hop in and say that we have a ton of questions, and I want to let everybody know that we will create a spreadsheet. Our staff, only our staff will see all of the questions, and then we will privately email you the answer to your question. So I know there's a lot of questions in here that we haven't got to, and our team is working hard to answer that. But just know you may also get an email from PEBB staff.
So, okay, let me just take a moment and answer a couple questions. I see if I ran out of money in my 2025 FSA account that had an eligible expense in August 2025 that wasn't planned, can I submit that between January 1st and March 2026 and use 2026 money? No, you cannot. Your 2026 money has to be for your claims incurred during 2026. So sorry, you can't use those. You can't use those for things that have already been incurred.
Hey, Linda, I think this will be a good one for them to know. There are a lot of questions on how to get the debit card or the name of the app. So the name of the app is ASI Flex Self Services. And in regards of the card, you guys can reach out or look at the website at ASI Flex, and they have the process to do that, to request a debit card.
So thanks, Anai. Yes, the app, you can just go to your app store and look at ASI Flex, and it's a little blue and white logo right now. You know, you never know because they always change it. But it says ASI Flex Self-Service, and you can download that app and get your account set up. And it's so easy. It's so easy to do that. And you can go online and do their whole debit card process to get the debit card also. Any other questions, Rhonda or Anai, that you think we should talk about before we end the webinar?
Linda, we're getting a lot of questions about, are you going to get a copy of the recorded webinar, and are you going to get the slides? Everybody will get emailed a recording of the webinar, and we're going to post the webinar and the slides on pebinfo.com.
Okay, thank you, Forrest. Right, I'm looking at a lot of the questions, and everybody's telling us their personal story and has a personal question. So it's there are hundreds of questions, but like Forrest said, we will answer them and try to get back to everyone. I think the main takeaway with this webinar, everybody, is make sure that you look at the mailings that are coming in from PEBB over the next month. Are you enrolled in the correct account? Is the amount that you want to put in correct? It's not too much, it's not too little. If you don't need the FSA, if you don't need the dependent care FSA because baby hasn't been born yet, then cancel it and sign up in 2026 when you're going to need to put baby in daycare. So I hope that that answers your questions. Again, you can find a link to the ASI Flex website through the PEBB state website, or if you just Google ASI Flex, it will take you directly to their website. I don't ever go through the PEBB website. I just Google ASI Flex. Somebody's asking about Garner. Is it optional or required if you use MODA? Garner is voluntary. So if you have not gone in and signed up for Garner and you have not added top providers to your profile, you're not going to get reimbursed through Garner. You do not have to participate in Garner at all. But if you do go and download the Garner app and you start loading in like your primary doctor, your cardiologist, your dermatologist, you start loading those doctors in, then you will, when you go see them in 2026, you will get reimbursed for them. Garner will know, but you do not have to participate in Garner. It's not a requirement. It's a perk. It's a nice perk. I don't know why people wouldn't participate, but you know, some people don't want to. That's okay. So somebody was asking that question, so hopefully I answered that. All right, everybody, I'm going to let you go. I hope everybody has a great rest of the week. And thank you so much. PEBB staff loves serving you. You are the reason why we have a job, so we appreciate you. And have a great rest of 2025, full of health and happiness, and a wonderful 2026. Thank you, everyone. Bye.